Hi, I'm Dr. Mary Stouter from Manchester West Veterinary Hospital. I wanted to give a brief overview of diabetes mellitus in cats. Diabetes, for short, is a disruption in the metabolism of proteins, carbohydrates, and fats caused by a lack of insulin or actually a resistance to insulin within the cat's body. It can show very slow and insidious. It's just a cat that's losing weight, drinking a lot, and urinating a lot. Those are the hallmark signs, your increased water intake and urine output. But it also can show up very dramatically as an emergency situation where the blood glucose gets so high that the metabolism is completely disrupted and the patient is very, very sick. We can diagnose this disease through a series of routine blood tests following a physical exam, checking for high blood glucose levels in both the blood and the urine. We can do a specialized test called fructosamine. Is a good way to monitor glucose levels. It actually tells us what the glucose level has been like for the last 2 weeks within the cat. Once we've got a diagnosis, treatment is tailored to the cat. It's not strict. We need to adjust it according to the cat's habits and lifestyles. We start with diet. We have a variety of diets that have been tailored and engineered to help the diabetic cat. One thing we have learned recently is that canned food can actually be a much better choice than the dry food. The carbohydrates in the canned are actually lower. Cats are a protein-based species. They rely on protein for their metabolism more than carbohydrates, so the protein levels are very important. Along with diet, we have insulin. Now, there are a variety of insulins out there. This is just one. Lantus is another brand that is used for cats, and again, will be tailored according to needs and how well we can maintain. It does take a level of commitment with the insulin and the daily injections. Cats do require twice-a-day injections for the most part, and so it does require a level of commitment here. But it can be a well-controlled disease. The patient, the cat, can live a nice, long, healthy life. Part of the control that we need to monitor is blood glucose levels. One is a very simple home glucometers. There is a variety of these on the market. They require very, very little blood, just a pinprick, a simple test, and very simple instructions. There are a variety on the market. Some owners can monitor these cats at home and regulate the glucose daily. Other cases require hospitalization and what we call blood glucose curve, where we check the blood glucose level every 2 hours following an injection of insulin to tell us when's the peak and how the dosage is doing. The fructosamine level I mentioned earlier can also be used to monitor how well a patient is doing on their insulin. Even the clinical signs. Some cats we just have to work with how are they feeling, how are they doing, how are they eating as our best indication for monitoring. So while this is a complicated and sometimes very technical disease, it is something that can be controlled and we can keep our pets happy and healthy. Thank you. Again, this is Dr. Mary Stouter at Manchester West Veterinary Hospital.